Morning. I don't complain much. I'm loved, mostly. Few exceptions.
To order the Human Services Committee, if we could all stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If the clerk could take the roll, please.
Commissioner Angie,
Present.
Commissioner Torello, Commissioner Samasco,
Present.
Commissioner Rushing,
Here.
Commissioner Vandenbosch.
Here.
Commissioner Beeden.
Present. Are there any additions, deletions, or changes to the agenda? Seeing none, I'll accept a motion to accept the agenda as presented.
I'll make a motion to accept the agenda as presented.
Thank you.
Second.
Thanks. All in favor?
Aye.
Any opposed? Motion carries. Citizens wishing to be heard tonight, the first one is David Huffman.
Thank you, Board, for allowing me to address you this evening. What I would like to do is open with prayer, if you don't mind. So if you'd bow your heads, please. Heavenly Father, as we gather here today, we seek your guidance and wisdom. We thank you for the opportunity to serve our community as private citizens and elected officials as well. May you give guidance, wisdom, and trust to those who represent us. Grant them clarity of thought and purpose as they discuss the matters that come before them. Help us to listen with open hearts and minds, to respect differing opinions, and to work collaboratively for the common good. May our decisions reflect justice, compassion, and integrity, and above all, the spirit of truth. We ask for your blessing on our community, that it may thrive and prosper. May we always strive to uplift those in need and foster an environment of peace and cooperation. In Jesus' name we pray. Amen.
Amen.
Thank you.
Kathy Swantek. And following Kathy would be Angela Dufresne.
Good evening, Commissioners. I'm Kathy Swantek, and I live at 5300 Vine Street in St. Clair, and I've lived there for over 30 years. I expect that as elected officials for each one of your districts, that you make decisions that are in the best interests of all your constituents. I know that is what all of you got elected to do, and I commend you for that. On September 1st, the St. Clair County Health Department discontinued services at Elginet Counseling and Medical Center, K-PAC School Wellness, Marysville School Wellness, and the Yale Counseling and Medical Center. All except the Marysville location served out-county residents. How many kids will not receive services paid for by county residents because of these accessibility issues? As a county health department, services should be available and easily accessible to all county residents. Discontinuing these services and making them less accessible essentially makes these services unavailable to the taxpayer. The closing of these clinics is a step backward, actually many steps backward for our community. We are known throughout the state for an exemplary health department in the state of Michigan. The other issue that will negatively impact the health of our county is a recommendation to discontinue fluoridation of public drinking water. We have heard from many experts on this issue at past health advisory meetings. Fluoridation is a safe and effective way to better oral health. Please do not discontinue this benefit. If you agree to this action, it will negatively affect your constituents. Thanks for giving me the time to speak.
Angela Dufresne, and then following her, Dr. Sherry Newman.
Good evening. Thank you for allowing us the chance to speak. I wholeheartedly support Dr. Nevin's directive on the health department, but I also wanted to mention the solar in St. Clair County. I've spent quite a bit of time creating a spreadsheet and a map to kind of map all the different solar leases, solar agreements that are currently in the county database. It's a total of 281 agreements, 15,546 acres that currently have agreements in St. Clair County. And I don't think that's all of them. I keep getting messages from other people saying, well, this developer is kind of nosing around this area. The last developer that I went through and added to the map had 104 different parcels involved, and it added over 4,000 acres. So I'm sure there's more than what's represented here. So I applaud this board and the health department for putting the regulations in place because they were very badly needed for our county. And that's it today. Thank you.
After Dr. Sherry Newman will be Eileen Watkins.
Good evening, Commissioners. My name is Dr. Sherry Newman, and I'm the current president of the Michigan Dental Association. I'm also a resident of St. Clair County. I'm here to urge you not to remove fluoride from our community water supply. Fluoride is a safe and effective way to reduce decay in children and adults. The CDC calls fluoridation the greatest public health achievement of the 20th century. Remember, fluoride is a mineral existing naturally in all water supplies. What it is not a medication. Fluoride is one of the several examples of everyday products that are fortified to improve our health, such as iodine in salt, folic acid that's added to breads and to cereals, and also vitamin D, which is added to milk. So what is it like without fluoridated water? I saw this firsthand when I opened an office, a dental practice in the small town of Lake, which is about 15 miles west of Clair. Clair is one of the poorest counties in Michigan. What I saw shocked me. Children with decay on every single tooth, decay down to the gum line. Adults not in very much better shape than that themselves, missing teeth, decayed teeth. People in pain, suffering, missing school, missing work. I had never seen anything close to this in my practice in Warren, Michigan. It was like being in a third world country. I questioned their water supply, and all of the people had the same answer. I have well water. And I said, okay, listen, let's get some samples sent into the health department. Let's find out what's going on with your well water. None of them had fluoride or very little amounts of fluoride. Nothing like we put in our water supply in our community. So it's very difficult to see the side effects of no fluoride, not only on their teeth, but on their entire life, where they work, how they socialize, how they try to hide their teeth when they smile or even talk to you. It's a disability, having broken down teeth. It honestly broke my heart to see people have to live that way in the United States of America this day and age. Lastly, I know there's information circulating about fluoride lowering your IQ. This information is absolutely false. The foreign studies that anti-fluoride activists cite involve fluoride levels that are at least double or triple what we use in the United States. The British researchers who evaluated these studies from China and other
I
countries.
need you to wrap it up, please. Everybody gets 3 minutes. So, need to wrap it up.
Okay. Lower IQs were traced to other factors, such as arsenic exposure and eating contaminated grain. I urge you, keep fluoride in our community water. Thank you very much.
Good evening.
So I apologize, Eileen. You wrote Watkins
Oh,
on
I
here?
apologize.
Yeah. So after Eileen Tesh will be Kathy Bladeau. Yes.
Good evening, Commissioners. You should have received an email from me today regarding pleadings from the State Board of Nursing Disciplinary Committee regarding Kevin Watkins, who is currently on the Health Advisory Board. He was disciplined back in 2003 after he admitted to misconduct performing physical exams on 2 minor students, one at his home and the other in his truck, and then lying about his credentials, misrepresenting that he was a NP, a nurse practitioner. Then he was later, after he entered into a consent disciplinary order, I believe from the pleadings, he violated that twice. I attached also a copy of his application for the appointment to the Health Advisory Board, and he obviously left that off. My point is that after witnessing unprofessional and unlawful, what I believe unlawful misconduct at the special meetings of the Health Advisory Board, particularly passing notes back and forth between 2 particular members, him and another member, during public comments, I urge you to remove Kevin Watkins from the Health Advisory Board. Thank you.
Kathy Bladeau and Bladeau. It's my least favorite part is pronouncing everyone's name. And then, and then following Kathy will be Lily Price.
Thank you.
Libby Prill, all right. You guys have very fancy cursive tonight, and it has been a very interesting day. So, thank you, Libby Prill. Thank you, Kathy.
Okay, thank you. My name is Kathy Blado. I'm a former nursing supervisor for the St. Clair County Health Department for 20 years, retired 4 years now. I live at 625 North Allen Road in Kimball Township. It's Mr. Felix's blank chair there. And I do applaud him for his integrity, by the way. And this whole process with the health department, it's been hard because there's been so much back and forth and so much craziness going on that we're missing the board. I feel like you're not really hearing all the people that have spoke against the closing of the clinics. And it's frustrating because I don't feel like we're heard. I feel like people are saying, thank God for COVID, when I don't think you really meant that in that realm, because there's probably people who lost loved ones to COVID. Yes. So I know you didn't mean it in that realm, but I think you meant it like you found out something against the health department. And there should be transparency in the health department because for 38 years it's been a clinical model. There's always been clinics, Dr. Nevin, in the community, as you know, after being here 2 years. I've not met you, by the way. And so I don't understand. I don't understand. Why can't somebody tell me the reasoning for this besides your concern for liability for your license and malpractice? If that's a concern, then I highly recommend the board consider. It was closed so quickly, too, 4 weeks, so quickly, boom, boom. Look for other ways to support Dr. Nevin in his role as medical health director. Get somebody else that can possibly work with you. I know you don't want to do that, but I don't understand why. So if it would mean do no harm per your license and your oath and your Hippocratic oath to the people in the county that you took, why not consider that? Why not consider working more with the people at the health department in administration to try and come up with solutions instead of, because the health department people, the nurses there, they're working for all of you guys, even those that are speaking badly about them, about what they said or did or whatever. They're working for you too. They're trying to keep the services for the county the county residents, including you, all of you. It's not about hate. It's not an us and them. It's not against Dr. Nevin. It's please listen to what all the professionals have said. I don't know what it is. If there's something behind the scenes going on that we don't know about, that you've promised, but everything can be fixed. So please consider hiring somebody else. Deb Brinson from the State Adolescent Health Center said there's monies available. If it's a money thing, there's monies available, but it just threw out the baby with the bathwater, and it didn't have to, I don't think.
Okay, need to wrap it up, please.
That's it. Thank you very much.
Libby Prill, and following Libby will be Margot Romero. Close. I mean, I should play horseshoes. I'll be good at horseshoes tonight. Close on everything. All right, Libby.
Am I good? Okay. Good evening. Gosh, it's been quite a battle out there in Facebook land of late. I think I've gotten to know some of you very well. So I think that there's a whole lot of, we've committed a lot of hours to this discussion for a board that has absolutely no jurisdiction over this. The Board of Commissioners cannot tell Dr. Nevin how to use his license. And I also think we had a couple of people that it was in their interest to kind of create a circus surrounding that and pitting, our wonderful staff of the health department against the public and vice versa. There is a game plan in place. I don't think that Dr. Nevin's intention, from the discussions that we've had and what he has said in public meetings, is to get rid of public health care. the role of public health is not clinical services. The role of public health is the data, the analysis, looking at the environmental, industrial. Yes, it is. Don't shake your head no at me. Yeah, yeah, it's not true, okay? And we have a man whose specialty is public health. Now, having said that, we know that the role of public health is not primary care, but that doesn't mean that we will not continue to offer those services. What we have an opportunity to do here is to partner with other clinics, possibly with the college, where we will not only be offering broader services, but it will be at more locations. This is an opportunity to expand services. And you know, Dr. Nevin, I don't know how many times you have to explain it. I don't know how many times that we have to, sit up and talk about this or post it, reiterate it one after another, and have people deny it. So in the end, I don't understand the pushback if you can offer more, both in scope and in location, to the community, instead of pigeonholing the services that this county is able to provide to a couple of locations that are very minimally serving people. I had somebody reach out to me from Algonac who said they didn't even notice that clinic had closed because it minimally serves people. Now, I'm just going by a resident from Algonac. That clinic closed 3 months ago. It had nothing to do with Dr. Nevin. It was closed because they couldn't staff it. Somebody went on, I believe, a maternity leave. They're low-paying jobs, no benefits. It's hard to get in peace in there for, a handful of hours. We don't have to fight about this. We can all come together to the board. I absolutely support. Thank you. I absolutely support Dr. Nevin. I don't want another doctor in here because I don't know where you would find one more qualified. Thank you.
Margot Romero, and following her will be Susan Ingalls.
Good evening, Commissioners. Thank you for hearing all of us. My name is Margot Romero. I'm a homeowner and a voter here in the city of Port Huron. With the closing of the school-based clinics in Yale, Algonac, and Capac, and Marysville, it's going to be exponentially difficult for teens needing sports physicals or flu shots or mental health counseling to get those services conveniently at school. Now parents in the rural areas are going to have to bring kids to Port Huron for those services rather than receiving them at entirely grant-funded clinics in the schools where they attend. How does this benefit the residents of St. Clair County? We need the board to explain their reasoning on this. How does this decision allowing these clinics to close help the people that you represent? From where I stand, it just makes no sense. The general public and certainly the Board of Commissioners understands that you cannot usurp the authority of a licensed physician or a county health officer. But the truth is that the board can wield its power effectively for the results it desires. You hired this medical director, and in the past you terminated a medical director that you did not support because of his directives. You do have that authority. Your refusal to act in a timely manner to avoid the closure of these clinics indicates that you are in support of the medical director's decision to rescind standing orders allowing the discontinuation of these services and the removal of these services from mostly non-Port Huron rural areas. You have other avenues available to keep these school-based clinics and community outreach programs open, and you've not explored these alternatives. No motion has been made, as far as I know, to hire an additional medical professional who is comfortable giving standing orders to enable these clinics to explore a replacement for, or a medical director no longer comfortable in operating in the healthcare paradigm in which he was hired. We can't accept this. It's not our fault anymore. You hired the person dismantling these services. It is your fault. We ask you to make it right, and I thank you for your time.
Susan Ingalls, and following Susan will be Dave Allison.
Hi, my name's Susan. I'm from Birchville Township. And I came to my first BOC meeting about a month ago because I heard about the fluoride going away in the water. And I spoke to you about how I was born in Detroit and how I was waiting on my bridge. Well, I have my bridge. I have a full smile now. I could chew and eat on both sides, so I'm very happy for that. But that's why I came here for, was to talk about the fluoride and taking the fluoride out of the water and what it can do to teeth and enamel and make it so thin that it decays. And then I'm listening to all these people talk. And I listen from professionals in the field, and they're talking about and they're explaining to me how fluoride works, and they're also explaining to me about the amount of particles per billion or million or whatever it is. This is just going by memory. And I even heard from a dean from the University of Detroit Mercy Dental Program stating that Windsor and Calgary back in the early 2000s, maybe 2013, 2011, they took the fluoride out of their water, and less than 5 years later, they had to put it back in because cavities were on the rise. And he's a professional. He knows these things. Dentists, periodontists, retired dentists came out and spoke to you guys about the importance of fluoride in the water. And we heard nothing from you guys. And then more public comments from very knowledgeable people about the outreach programs, Algonac, Yale, KPAC, even Council on Aging in the Soup Kitchen. You know, I did not realize how badly these services were needed in our community. And now they're being, oh wait, they are gone. And also from the public were administrators from the above schools that came and talked, even from RISA too, that came and talked and said, hey, we need these in our communities. And I heard nothing. And then I have more public comment, because I was on vacation for the last two meetings, so I YouTubed them. More public comment learned about physicians' standing orders. I didn't know what those were. I know what they are now. And standing orders in hospitals, nursing homes, outreach clinics that health department staffs with nurses and nurse practitioners. And nurses and practitioners have license too. And then heard about the health department's physician's license could be on the chopping block if nurses were to do something wrong. So memorandum goes out saying no vaccines, no testing at outreach centers, only at the main center downtown Port Huron. And our health department, God, I found out, he only works 16 hours a week. And who proposed these hours and pay? Was it you guys? Was it this board? Is that how he got hired in? And if so, can't you hire somebody else to help with these clinics?
Need you to wrap it up, please.
Okay. I'm a registered voter, and I'm sure there's lots of registered voters here tonight.
Please wrap it up. You get 3 minutes. Everybody does.
All right, thank you.
Thank you.
Dave Allison, and following him will be Diane Lois.
Good evening, Dave Allison, Anoke Township, Michigan, lifelong St. Clair County resident. I don't work for the health department. I'm a citizen and a taxpayer. That's why I'm here today. When I hear health professional, I break out in the cold sweat anymore. No offense, Dr. Nevin, because we have so many health professionals in this country, but yet we're the sickest, most mentally and physically sick country by almost bar none, especially for what's considered a first-rate country, right? So that professional thing anymore doesn't carry any weight. I came to share a philosophy with you that's worked well for me. When I was growing up, when I started our family, wife and kids, I was like everybody else. Most of the Americans, very little finances. And when my kids would come to me and say, Dad, I'd like this, or we didn't have the finances, it was hard to say no. Later on in life, though, then I became financially more abundant. I had the finances, and when the kids would come to me and ask me for something, it was even harder to say no. But I had to say no because I knew what was best for them. So as a board, representing the citizens of this county, what's in best interest. I don't expect the government to provide every need for me. I expect you to say no. Because I didn't get this white hair from the stress of raising a family or a job. It was trying to pay my social security tax, my income taxes, my property taxes, my fuel taxes, my sales taxes, everything. Every dollar that this board spends, that has the authority to spend, I gave a portion of that. And I want accountability, and I don't expect you to provide anything. So your job is not to be and I want to read something. This is a text out of a book. It's the most popular, it's on the most popular list, Stellar's list. There's trouble ahead when you live only for the approval of others, saying what flatters them, doing what indulges them. Popularity contests are not truth contests. Look at how many scoundrels that we have, and even in the medical profession, who profess to be professions, but they're scoundrels. Your task is to be true, not popular. Thank you.
Diane Lois, and following her will be Dr. Gilhui. I hope I pronounced your name correctly.
Hi, everybody. I know we're getting tired of hearing some of the same thing over and over again. So I just want to put one more quick spin on it for you, just a consideration. Public health actually began with the schools. It was driven by the school districts in the 40s, and all the physicians and all the communities saying we got to have a county-wide to be efficient and effective as possible. And that's where it began, and to this day we still have that support. Have any of you up here at this table attended or visited a COVID clinic while we were active? If you could just raise your hand. Okay. What you would have seen was a group of people trained, prepared, exercised, tested basically, monitored by the state, plans submitted to the CDC. They know this upon hire as a public health employee, that we are that entity in those times that do this. We're responsible to be able to provide emergency prophylaxis to dozens, hundreds, thousands, even the entire county of St. Clair County within 12 hours or less. That's in our plans. That's what we're going to do. If that, God forbid, that ever becomes a reality. But that's what we have to do. And that's not just us. It is all local health departments throughout this entire country, whether they're local or state. We have to have those in place. And there is not going to be any rescue teams coming in. We're going to do it ourselves because it's local, because there are no rescue teams. It's self-sufficiency. Our emergency clinics are an offshoot of our outreach that occurs right now, whether we're doing it at the schools or we're having a special flu clinic or there's a meningitis outbreak in the high school. All these experiences, we use the same basic methods, the same basic thought process, how to bring people in, get them into the right lane, give them information, keep them calm, make sure the right people are here for the right reason, get them what they need and out that door as fast as possible, because if we're not quick and efficient, incubation kicks in, prophylaxis is no good. Now you got to go to the hospital. That's the whole treatment side. One of our most important jobs is to keep that overflow from the hospital who does not need to be there, the walking wounded, okay? Come to us, we'll get your needs met. Protect the hospital so they can treat the truly ill and sick people. And we work closely with the hospital and all of this planning for the strategic national stockpile. And if you want it here, you've got to have the plans, they got to be approved, and we are. And we're very good at it. And you please trust us. Our families live here, we live here. Many of us are multi-generational, including your health department. We want the best. We know you want the best. But there has to be, like Kathy was alluding to, there has to be some middle ground. Get down to the core issue and let's address it. It's really a health department internal discussion. I know we can find a way. But don't forget, you don't have the plan B. We are your plan A and B. Thank you.
Dr. Gilhui, and following him will be Carol Miller.
I'm Dr. Ralph Gilhooly. I'm a retired dentist from Port Huron. I'm here in support of the fluoridation issue. I appreciate Dr. Newman's comments earlier. I'm also here to request that you reject the memorandum from Dr. Nevin asking to ban community water fluoridation in St. Clair County. You've heard from numerous people who have referred to literally hundreds of scientific studies whose facts support the absolute safety of fluoride in the water system. You've also heard from numerous experts on the tremendous health and cost benefits of fluoride in the water system, especially helping the most vulnerable here in St. Clair County. What you've not heard is one single study that shows that fluoride in the water system causes any health issues, not one. 80 years of studies showing its safety and benefits, and yet not one single study shows any harmful events. The report that Dr. Nevin uses as the basis for his request to ban fluoride has absolutely nothing in it that even hints at fluoride in the water system causing any health issues. And he knows that. That report, by the way, was so bad that it took the National Toxicology Program 8 years to separate all the facts from the fiction and come up with that report. Please ask Dr. Nevin to come back to this board with one single study that shows that fluoride in the water causes any health issue, just one. There are hundreds out there that show the benefits and the safety. I want to see one that shows it is a problem. If you have any questions about the fluoride issue at all, the Michigan Oral Health Coalition, I think you all have a copy of this that addresses every possible scenario with the water issue. I would urge you, listen to the scientific evidence, listen to the experts, and maybe most of all, listen to the vast majority of St. Clair County residents who do not want to lose the benefits of fluoridation that they've had for over 60 years. Don't take St. Clair County back to the 1960s. Thank you.
Carol Miller, and following Carol will be Kim Schiebel.
At least I had an easy name to say.
Yeah, thank you.
The growing conversation around the health department has unfortunately shifted away from the real issue at hand, the urgent need for restructuring. At the heart of this discussion is a simple but often misunderstood truth. A health department is not a primary care clinic. The mission of a health department is to safeguard public health through prevention, education, and community-wide initiatives. It exists to track and manage communicable diseases, ensure clean water and food safety, promote vaccination and wellness programs, and prepare the health for public health emergencies. It is not designed to serve as a replacement for doctors' offices, urgent care centers, or private medical providers. When time is spent on accusations and misinformation, we lose sight of what truly matters. Relying on the health department to function as a free primary care system not only misrepresents its purpose, it strains resources and prevents it from fulfilling the very responsibilities that protect the entire community. Instead of fueling division, we need to come together, seek solutions. The challenge is not to expand the health department beyond its mission, but to strengthen partnerships with medical providers, community organizations, and local leaders who are best equipped to deliver primary and specialty care. I urge everyone, listen, learn, and focus on solutions. Let us protect the health department's true role so that we can continue to serve the community effectively, not as a clinic, but as the foundation of public health. On a side note, most of you know that I've been a nurse a long time, 42 years. It's a long time. I've worked a lot of different realms, private practice, inpatient, outpatient, home care, you name it, I've done it. I've been going to the health department meetings since I retired about 1.5 years ago. I've learned a lot, I've seen a lot, a lot of good things, some negative things. But as a nurse, and a lot of you here are either retired or still active nurses, we do everything, and we really think outside the box. I really think if everybody, instead of complaining, comes together with one solution, we can do this and make it work, and not have it as a primary care clinic, but provide better services for everybody. At the north end of St. Clair County, we have Sanilac County. Most people don't know, but there's a group up there, Aspire Rural Health Systems. They're growing. They're right on the border of our county. They have all sorts of neurology, urology, family practice, and everything. Why not look to see if they can help us up at the north end of the county? Think outside the box. So I hope to see the many of you that have now decided to come out to these meetings, join us at the health advisory meetings and bring some positive solutions. Thank you.
After Kim will be Sydney Barnes.
Thank you. My name is Kim Shively. I'm a Fort Gratiot resident. I grew up in Yale, so Yale means quite a bit to me, and I know that it's a poor area. I know that the health clinic at the schools is something that's desperately needed. I ask you to listen to all of the experts that have spoken, not just about the health department, but also about the fluoride situation. Listen to all of them, and maybe that will override just one person's view. Thank you very much.
Sydney Barnes, and following Sydney will be Dr. Saman.
My name is Sydney Barnes. I'm a lifetime resident of St. Clair County, and I'm also a local speech-language pathologist. I'm not here on behalf of my employer, but I am here to speak as a citizen. I currently provide school-based services to children and young adults from all 7 of our county-wide school districts. Much like Dr. Nevin and the numerous doctors, dentists, and healthcare professionals who have spoken in these meetings, I must follow current evidence-based practices in my work. As medical professionals, we're well-versed in scouring medical databases and interpreting research, doing some research on our own, related to our own fields of work. And that's why it's so disappointing to many of us to see that so many recent decisions being made and being supported by members of this board are driven by opinion and bias, not fact. In addition to evidence, it's our responsibility as medical professionals to take our own clinical experiences and client values and preferences into consideration when providing treatment and services. I've provided services for children in this county for about 7 years now, and you've heard from numerous other medical professionals who've been servicing this county for 20 or 30 plus years. And over again, we have reiterated to all of you the need for widespread and readily accessible healthcare services in this area. There's a clear disregard for the factual definition and purpose of public health and for evidence-based practices related to fluoride, vaccines, and prevention of communicable disease in this area. Decisions are being made based on opinion and bias, not fact, and that is unacceptable in the field of medicine. Lastly, I do like to be an informed voter, not only in state and federal elections, but in local elections as well. So with that said, while I've inferred a lot from these meetings, I'd like to know where each of these board members stand on these issues, including fluoride and closure of school clinics. As citizens that you're responsible for serving, we deserve to know where you stand on issues that impact us. And for the last minute or so, I'd like to refocus my thoughts and words to the community members here today, and many of those who have attended previous meetings related to these issues. These are the very people that you were all elected to serve. I'm very proud of this community of advocates, critical thinkers, researchers, helpers, and deeply caring individuals. It's all of you who give me hope and allow us to move forward and continue to serve others with faith and not fear. It is all of you who will ensure this community is okay, regardless of what the powers that currently be throw at our children and people. Thank you, guys.
Dr. Saman, and following Dr. Saman will be Lauren Krewall.
Good evening. My name is Renda Jundi Saman. I am a dentist in Port Huron, Michigan, and I live in Fort Gratiot. Thank you for hearing me again. I know you see my face every meeting in the last few weeks, and I apologize for that.
but there is a reason why we all keep coming, because we are severely concerned about the notion and the recommendation of Dr. Nevin to ban fluoride from the water. This hits home, it hits the bone of everything we do and everything we breathe as a dentist. If you have a problem with your water, you call your plumber. If you have a broken bone, you go to the orthopedic surgeon. If you have a toothache, you go to the dentist. Listen to the experts that came over those months or weeks, I should say. From the Dean of Dental School, from Detroit Dental School, who drove an hour twice, to Dr. Newman, to the American Academy of Pediatrics dentist who came, to the multiple dentists and specialists who came from the county. We are concerned. We don't sleep the night worrying about this. Not because I'm going to get hurt, it's because my people are going to get hurt, my patients are going to get hurt, the children and the adults in this community are going to get hurt. Please, I urge you, listen to the facts like the lady before me said. Don't listen to one article that was not US-based that said fluoride is harmful. There is so many hundreds of them that we have facts of, that we live and breathe. The dental associations and all those dental organizations follow on a daily basis. Thank you.
Lauren Krewall, and following Lauren is Gloria Moore.
Good evening. My name is Lauren Krewall. I'm a resident of the city of Port Huron. I urge you to consider the gravity of this change for school clinics that the health department has historically been a part of. The impact that this will have on our communities is very great, as we've heard over the last few weeks. If the aim of these changes was to expand services, I would think that it would have been done with less haste and with more forethought of the solution prior to cutting out the services. It's been mentioned multiple times having different medical facilities take over these clinics, like community first health centers. But I would think if there was resources and there were support for them to take over these tasks, we would be hearing it. Well, the conversations they would be more known. We would be hearing from Dr. Prieb if he was in full support of taking over the clinics in Algonac. And I fear that since we have not heard that those conversations maybe aren't going that way, or they aren't happening, but we've not heard anything from any of those other medical facilities that could be taking the place of the health department with these school clinics. I thoroughly feel as if this, again, if this plan was to expand services, we would be working on those plans before we cut out services, and having a huge gap in the ability that we're able to care for folks would have been not a forethought, it would have been part of the plan. So I again urge you to consider the reach that this has and the potential consequences that it will have on our communities and on our families and our children in our county, and how that can ripple through generations as these children grow up and think about the things that were removed from their life. Thank you.
Gloria Moore.
Good evening. My name is Dr. Gloria Moore, and I'm a family nurse practitioner. I'm also an almost 30-year resident of St. Clair County, and I get the absolute privilege to provide care to county residents. According to Michigan.gov, local health departments, quote, aim to protect and improve the health of the communities that they serve by preventing and controlling the spread of disease and injury, among other things, including promoting healthy behaviors. According to the Michigan's Guide to Public Health for Local Governing Entities, a public health function is distribution of medicines and vaccines, and that is the value to the public is that it prevents and treatment of disease to reduce further spread of the disease. Another public health function is health education and promotion, to inform the public about health behaviors. Page 7 states, public health strives to prevent disease and injury throughout our communities, to assure a healthy population of all ages and to avoid costly public and private social and medical costs. Page 8 to 9 states, public health seeks to ensure the following. All populations within the community have access to health care services. All populations. Page 25 references the 3 core functions of the Public Health Department as assessment, policy development, and assurance. Assurance of access to health care. The social determinants of health are part of Healthy People 2030, which is released by the U.S. Department of Health and Human Services every decade since 1980. Healthy People 2030 identifies scientific-based objectives with targets to monitor progress and promote and focus action. One of the goals of Healthy People 2030 under healthcare access and quality is increase access to comprehensive, high-quality healthcare services. Under their goal, there are 5 objectives, but the one I want to reference today is to increase the proportion of adolescents who had a preventative healthcare visit in the past year. The most recent data was only 69.9%, with a target of 82.6%. So I went to the St. Clair County Health Department website and listed the vision as healthy community, healthy environment. And it further states that the St. Clair County Health Department has evolved with the mission reflected in the Michigan Public Health Code to continually and diligently endeavor to prevent disease, prolong life, and promote the public health through organizing programs, including development of healthcare facilities to delivery service systems and prevention and control of health problems of particularly vulnerable population groups. And I go back to Healthy People 2020, where our teens, our adolescents, your children, your grandchildren are not getting that visit every year that they require. And then I looked at other health departments in the state to see what they were doing. And the Grand Traverse County Health Department has several adolescent health clinics conveniently located in or near schools. And clinics offer easily accessible and high-quality healthcare services to young people while accommodating class schedules and parent work schedules, general medication, health education, and mental health. And also the Gwen Teen Clinic in Marquette. Thank you. So there are multiple other counties that also provide in-school clinics. So if we could look together to work to make sure that our adolescents, that our children have the help they need. Thank you.
Are there any other citizens wishing to be heard in the Human Services Committee tonight? Okay, if you'll fill out a slip. Thank you. That's okay. Thank you very much. Jimmy Dado? So close.
Thank you. Jimmy Dotto, 9th Street, Port Huron. Wasn't going to come here tonight because it didn't seem to matter what we had to say. My only question is why? Why won't this board listen to what the professionals are saying, to the outcry? With all due respect, Dr. Nevin, how do I put this? Why now? Where was this concern 2 years ago? Right? This moved so steadily and so quickly. And we still don't know why. I come here because I grew up poor, grew up on a farm without fluoride in the water. I have a mouthful of cavities. It makes a difference. The outreach that we do makes a difference. How is it outreach when we've got to come here? You know, I heard you, Mr. Rushing, on the radio the other day discussing these matters, and it occurred to me that you You slammed our council member that is not here, saying he wasn't getting his way, and that's why he resigned. No, I believe he resigned because you weren't listening to what we're saying. Please don't cut the funding. Please don't cut the outreach for the schools. I grew up poor. I needed that. All right? I needed the outreach. We didn't have a car. We didn't have a way to get to places. The bus doesn't run out to Yale. Think about what you're doing, who you're affecting. Please, please don't take fluoride out of the water. That's all I got.
Are there any other citizens wishing to be heard this evening on health and human services matters? Seeing none, we'll move on to updates. Any updates from commissioners?
I just have one on a comment that was made in regards to Dr. Mercantile. I believe that was it. She was afforded the opportunity to reapply. She was not fired. She chose not to reapply. So that's how the position got opened and wasn't offered to her. That was her own choice not to reapply. That's all.
Any other updates from commissioners?
I have an update. I attended the ribbon cutting for the bookmobile recently, which was a fantastic event. Attended that with my 12-year-old daughter Lucy, my husband John. Some library board members were there. Mr. David Brooks was there, and Mr. Whipple was with us on a placard standing behind us next to the bookmobile. It was a fantastic event, and so I just wanted to put that out there. If you get a chance to visit the bookmobile, please do.
Great, thank you. Any other commissioner updates? Seeing none, we'll move on to conceptual initiatives. Tonight we have the item health department funding discussion. I know this was added previously by Commissioner Felix. I would still like to have this discussion tonight. I think it's important that the community has come out, and I think it's important that we have this discussion in front of them. So we have been working on solutions. I know that Liz King is here. I know she's been working with her team, including Dr. Nevin, on some solutions. So Liz, do you want to come and give us an update on that?
Thank you. First off, thank you for letting us talk about solutions. I think we've heard a lot of comments from the public on both sides, and everybody's bringing up great points. And we've heard from public, we've heard from Dr. Nevin and his memo. Certainly, we've had conversations as well. Our advisory board, we didn't quite get there. Hopefully, at the next meeting, we'll have some more discussions. But I think it's time to talk about solutions or answer questions and what that looks like. Everybody's waiting, like, what are the next steps? What can we do? And I think I just wanted to speak from a health officer perspective here and what that means, right? As like the chief operating officer of the health department, what does that mean from my perspective? We've heard from Dr. Nevin's perspective, which is medical, and I have a lot of respect for what Dr. Nevin has done, what he wrote down, how he feels about these clinics. But there are some other things to take into consideration, and I just wanted the opportunity to kind of explain that to everyone, where my perspective is, and then how we need to get to solutions. So first off, I'm committed as a public health professional for over 23 years to maintaining these services somehow. I think the public has overwhelmingly told us these need to stay. Something needs to stay at these schools, at these rural areas. How we get there, though, we need to come to consensus on, we need to compromise on, and we need to work together on those things. So from my perspective, things that haven't been mentioned, I always make a chart, so I'm a planner. So I made my chart and what it looks like to me. There's 3 different options to come up with, and I looked at what each of those options do for the clinic operations, the financial impacts, which we have not talked about. But from my perspective, as health officer, that budget is under me. And what are those financial impacts between A, B, and C? How about the staffing? How does that impact our staff? That's very important to what we're doing. In any of the situations, you kind of have to navigate each choice and know what you're up against. So I laid out the staffing. Community and school trust, that's huge. I came into this role in a time where trust, it still is not there where we need to be. So since I took this job, I think in my interview, I mentioned how important that is, that trust level and these relationships with our schools, with our communities. Just bailing on them is not an option. That's not an option for Dr. Nevin either, to lose trust with our schools. They are partners with us, and RISA and everybody out there in the medical community. So I listed that as well. And then supports for Dr. Nevin. Dr. Nevin is our medical director. He has the right to lay out in his memorandum how he uses his medical license. All of this, he very much can do. He knows that. We've talked about that. We have some disagreements on how we get there sometimes, but we can have those discussions for sure. But making Dr. Nevin comfortable in his role is important to me as well as that administrator. For all my staff, they need to be comfortable in what they're doing. Forcing someone into a role that they're not comfortable with is not something I want to do for any staff member there, including Dr. Nevin. So I don't know how in-depth, Lisa, you want me to get with these, but option one is do nothing, and we just let these end. You know, I don't think anybody wants that. Option two is, which has been listed today, identify alternative organizations to administer this grant. We can look at those other organizations. There are discussions happening with some of them. What is their capacity to take this on? And that's important. Yeah, I see Lily shaking her head. Yep, I agree. That is important. But no, when we wrote this grant, there wasn't the capacity to do that. We definitely scoured the community to see, is anybody else going to provide this service? Are you willing? And that wasn't there. If things have changed in the last couple of years, we need to identify that as well. Additionally, I think we all need to remember we're in a position, you know, almost desert here of what goes on. So sometimes the pool of people to take on these clinics just aren't there, and the health department has filled those gaps over the years. Dr. Nevin's shaking his head, and he wants to, you know, change that direction, and I respect that too, and we can do some of that for sure. Option three then is what has been brought up as well by the public. By our grantor, that the other option is to have a physician more suited to clinical care, like a family practice doctor, a pediatrician, kind of oversee those clinics, take them off of Dr. Nevin's liability, his liability insurance, and coverage. There's that option as well. So each one of these things, and I'm happy I can share this document with you as board members if you're interested on what it means to the financial impacts of each decision. Most importantly, I do want to point out, while I have time, option two, rolling this grant over in the contracts, we would lose close to $450,000. We lose the billing revenue. We lose that Medicaid reimbursement. And then per Dr. Nevin's memo, he is asking that those nurse practitioners be relocated back to the main office and our teen health center at Port Huron High. If I don't have those dollars, I don't have a funding source. We talked about that. He's aware of that. We can look to those dollars too. That would make him more comfortable in his role to have increased mid-level practitioners. But at this point, you know, I'm at a loss of how we're going to do that or where those cuts would be made, or if there's more money, you know, I can ask for coming up with a new budget year. So that's a loss on our budget. That's in the red. The third option of that physician, maybe 1 day a week, half a day a week overseeing, that keeps us more balanced, almost balanced to a $10,000 limit, but there. Staffing, I could go on and discuss each thing in depth, but I don't need to. I will give you the document, and certainly you can ask any questions to me separate, or Dr. Nevin, we can meet with you on those options, but I'm committed to finding the solutions. I think Dr. Nevin is too. I think there's going to have to be some compromise. It may not look like what I'm going to see, and it may not look like what he's going to see, but I think we can get there, and that's what we need to do.
Liz, is there a deadline for the grants?
Sure.
Do they expire, I guess, is the question.
Right, so the grants run on a fiscal year, meaning September 30th, this grant year is complete. And typically, those grants just would roll over for us. We had the one-time really large application, which you approved in spring of 2023. We don't have to do that application every year. It just rolls into our budget. The state's waiting on a decision. You know, are you keeping these? Are you doing option A, B, or C? What are we doing? But we have to have an answer certainly within the next 2 weeks.
Okay. Commissioner Rushing?
Yeah, I have about 3 questions for you.
Okay.
Because everybody came here and said that these services are so critical to the residents of St. Clair County. The Algonac Clinic has been closed for months. If it's so critical, why wasn't it restaffed and kept open?
Right. So there has been staffing issues. We had someone go on maternity leave. We had someone vacate a position. And that I can talk to you about why she vacated that position separately. And then the backfill was difficult. So we put RNs, which was acceptable to the grantor, in that spot. They weren't closed. The services were still there. And then remember also, it's not just the physical health. This is paired up with a mental health provider, and those services all continued.
But it's been closed, so.
I don't think it's been closed.
Restaff it with qualified people there, but it hasn't been. Dr. Nevin's been working with you, and you and I talked for quite a bit at the time. And I said, you need to work this out. Apparently, it hasn't been worked out. But this has been discussed for more than just September 1st deadline. This has been discussed for half a year at minimum. And you haven't come up with the solution as of yet. You two should have worked this out some way and given us a proposal. We have not heard from the Health Advisory Board. You know why that is. It's part of what we have here with all the discussion, great discussions, both sides. That one meeting went, what, 5.5 hours? Another one went 2 hours, 7.5 hours. We probably have 5 hours tied up here. And we still haven't got the Health Advisory Board to make a vote and a determination to take care of your business. If we're going to usurp that, which Mr. Felix wanted us to do, and have a motion for us to potentially make a vote on potentially addressing statutory duties, your duties and his duties, and I believe that was unlawful. That's why he didn't even get a second. We are waiting for the Health Advisory Board. If we're not going to listen to the Health Advisory Board and get us an answer, then we don't need a Health Advisory Board. So just on that issue. So there's the time frame. And I talked to the superintendent at Yale Schools, and of course I'm old, I'm the oldest one up here. So when I went to school, they had a school nurse. Are any of the schools willing to give any funding to assist? Because of course Yale is free. Back when I was in school, every school had their own nurse. It was not county health care. It was individual in the county. When I came back, Dr. Conrad did all the physicals. And I'm going to use Yale as an example. I'm going to assume my math might be off, but 1,500 students, 500 in the high school, if 20% participate in athletics, that means that you've got 100 people that need physicals. Couldn't a local place for $50 or whatever that is, look into it to a local doctor, just like Dr. Conrad did in KPAC? Or I don't know how Richmond's doing it there. I don't believe Richmond would go to the Macomb County Health Department. I don't know that though. But if they could assist in the funding in these clinics or the local doctors, it wouldn't be an issue as far as the students themselves. So I think they can contract with their local doctors at a minimal cost. I had 5,000, let's say, physical takes $50. I might be very lowballing. It might be $100, $200. But would a Yale school district be willing to put $5,000, $10,000, or $20,000 out of their budget? Because they got a very good budget millage, and it's over $10 million that they got. Can they use some of that funds to assist in taking care of the medical issues for their students? The last one, we brought up tonight, $450,000. The previous discussion for the grant was $180,000. Is that combining both clinics or just the one clinic?
That's combining both clinics and our Marysville contract. So do you want me to answer these questions or comment or?
Everybody's here to get some information. So.
Okay. I can't speak for a district or what they can do with their funding. Up until now, I think only one district, East China, was paying separately for a RN. Then we know Marysville was paying us for that RN. According to Dr. Nevin's memorandum, that RN cannot perform those services anymore, and that's why Marysville said, no, we're not going to pay an RN, wage full-time because that person cannot complete those services under his directive. Could they use that to contract with someone else? That'd be up to the district.
I would, and I'm going to interrupt you, I'm sorry, but both sides. We've got the new $6 million facility, and from my understanding, it's very underutilized currently. Hopefully, we address that, get services, we use the facility that we spent a lot of money to get. Your road used to be over on 32nd Street, 34th, 32nd.
Moak,
And
yep.
and I'm not sure if, I used to live 2 blocks from you when I had no money. You had the one person here stated he grew up poor. Well, I grew up without. When I married my wife, we didn't have a bed. We bought a house on Peavy Street, 3109. So we had a 2-bedroom house with 3 kids. So I understand the poor, and I've worked my way out of that. But let's assist in their Public Act 241, I believe it is. I might be mistaken. It might be 251. The buses are required. City of Fort Huron, they get funding from Emmett, they get funding from KPAC, they get funding from everybody. All you have to do is call for a bus. And if you have a scheduled appointment, they can meet you or your health department in your office at their convenience. So if they need to come down here for a physical or whatever they need to do, a vaccination, call up the bus. They are required to go out and pick you up. I live out in Riley Township, and those buses come out there, there's nobody in them. But they are required by law because they're getting the funds to run those buses. And of course, the Village of Emmett can't have their own bus service, so they defer those funds to the City of Fort Huron. So please look at that as one of your options, because unless it's an emergency, and I think you go to your local health care, wherever it is, an emergency might, and I don't know if I brought this up, my grandson, I hired him, he just graduated from Memphis. He was working at the farm there and not paying attention, watching his phone, and I got a 32-ton log splitter. Well, it took the end of his finger off. It's gone forever now. And he got sent to the emergency right away. They couldn't save the finger, so he's going to have to live with that poor decision. But anyways, that can be possibly part of your solutions to this, because for known things that people in this county, whether you're in Riley Township, KPAC, pick your Cotterville, wherever, they can just call up, I need a bus. Can you pick me up? And they can bring them here. Doesn't have to be with the parents. I mean, you know all this, so I'm just saying there are options.
So there are options. I mean, if we get to that point, perhaps that could be there. But as a student in a school, one of the goals of that program is to get them back to class. We know how important it is to the schools, to the kids, to the parents, to limit that amount of time that they're out of class, and that's the convenience of being there. A ride from Emmett to our health department and back.
About an hour.
Each way, you know, I don't know how the
Half hour
bus
each,
works,
right?
but you're talking 3 hours of a visit versus 30 minutes out of class, back to class,
If
so.
they're in the classroom, that isn't the same thing as coming from Emmett. Now, you're taking a person that lives in Emmett, or pick your
Yeah.
location. But if it's a known thing, and that's our statutorial duty, you have your statutorial duties, which I've addressed in Dr. Nevins. We have no authority to usurp your statutorial duties, and we should not. We can't make decisions that you make a decision as the health officer. We can't do that, and we shouldn't do it. So I would be very careful about us making decisions on your decisions that you are required to do. I hope you work it out. I hope you get solutions made. And I think Dr. Nevin and you can do it. You and I talked about this for 40 minutes. Get it done. I don't think we cannot, in my opinion, we don't have the authority to keep the clinics open. That's not our decision. Legally, I don't think we can do that. If we said those clinics are going to stay open, and we have our legal counsel, I don't believe we can actually do that. You might give a legal opinion or give it some thought, but I don't think we can usurp your statutorial duties, whatever your decisions are between the two of you.
You'll support. That's great. Thank you.
Liz, can you elaborate? I know that there was some funding in the schools, to Commissioner Rushing's point. The schools did invest in these clinics. Can you talk a little bit about that? I know Yale rebuilt a classroom, they converted rooms.
Right,
into
so
clinics.
in-kind support, certainly. So they are not adding in direct funds, but there's a lot of in-kind support offered by the schools. Yeah, you're right. So that would be the space, the heating, the cooling, the water, the IT, Wi-Fi, all of that. So they are added into the grant as that in-kind use.
Commissioner Vandenbosch.
I'm used to emergency medicine and not public health. How if I roll up on a patient as a firefighter and I start rendering aid, why is that not abandonment when you guys shut off a service to a community? I mean, if I left that patient after starting service on that patient, I would be sued for abandonment. You're abandoning a whole area, a community, and I've heard Dr. Nevin's thought process for it, but we need to get something done. I mean,
I agree.
I mean,
agree.
school
We have to-
started.
Yep, we're at that point where something has to be done. There needs to be compromise made. I agree. But as far as abandonment, we talked about this, and we notified certainly everybody within a time frame, parents, schools, patients who were there. I think we legally did exactly what we needed to do. I understand just leaving
But
an
it's-
area. I agree with you. I agree. I'm disappointed. You know, we all worked really hard to get these going, and we do need to find a solution, so as soon as possible.
Just one more statement.
But before you go, any other commissioners have anything they want to add?
I do. Liz, thanks for meeting with me the other day at the Health Department.
absolutely.
It was a beautiful facility, and I really enjoyed the time that we had together. It was very informative. I am wondering if you have had the opportunity to speak at all with some of these other community organizations, such as Community Health or Community First, Aspire, the Bay Area place. Have you engaged any of those people in conversation about filling in some of these gaps for services for these people that need them?
I have started those conversations locally with Community First Health Services. I have not spoken with Aspire. I can do that for sure. That was great information. I have spoken back with our grantor, MDHHS. They have a good handle on what's going on around the state and who is willing to take that on, who has the capacity. So I engaged with them. I also engaged with SHAMI, which is our advocacy group, so your school health advocacy group, to say, what are you hearing? Who has the capacity to do this? Whether it's the physician, whether it's the whole center. And we're talking, and there isn't much there. Community First, you know, we had some positive conversations about what we're looking for. That will continue.
All right.
Yeah.
Thank you.
Nope, I'm sorry,
not gonna
Mr.
have any
Rushing.
comment.
Mr. Rushing, everyone hasn't had a chance yet, so we're going to defer to Commissioner Samasco.
I thought we should say something. You know, one of the folks got up here and talked about how he wants to know where every commissioner stands. I'm very careful about the deliberative process in the Open Meetings Act. And I do try to keep an open mind. I talked to Liz an hour and a half ago. I talked to Dr. Nevin this time. I've talked to many citizens. I had a woman from Clyde came in that had very strong opinions, and I learned some things from her, and we didn't agree on everything, but we talk about a lot of things. So the public health code has been around for a long time. The model we currently have is with a medical director and a health officer. The prior model was a medical health officer. That was the Mercantile. And I was here back when they hired Annette Mercantile. We didn't have any issues. It was smooth sailing. You know, Liz and I talked about that. Well, things change. Things are different. Things move on. Communities change. Values, principles, all these things change. So under the public health code, our current model is a medical director who, under the public health code and under the administrative rules, is supposed to direct medical policy and operations. And we have a medical health officer who's the director of the operations, who has equal competency and statutory duties to do certain things herself. I look at that kind of like with Mr. Fletcher here. He's our county lawyer. I'm a lawyer, but I'm not the county lawyer. I said it many times. I try to defer to Mr. Fletcher, and there's times I haven't. And I've told him that. I disagree with you. But if a county legal authority says, hey, this is my opinion, I tend to defer to that. So here we have the medical doctor, and I had to embark on what is medical practice, what is medical care, what is delegable medical duty, what is the standard of care, what is the client or patient-doctor relationship, what is counseling, what is community care. It's a lot of information to try and sort out for non-lawyers, for citizens and for people. So, but on the general scheme of things, I want them, and I've talked to Liz, we talked about it, and she agreed with me, and Dr. Devins agreed with me. You know, they need to collaborate and partner. on operating that facility. I'm not a doctor. Paul Miller said on the radio the other day, he says, and he never played a doctor on TV. That's right. You know, these folks are the professionals. They're credentialed, trained, experienced. They need to work that out. And one of my rules in law practice is I never do anything fast. I'm never in a hurry to make a mistake. So it may take some time. The clock is ticking, but we got to get it right. And there's always other options. The one grant, both grants were $180,000. Liz sent me copies of the grants. I read everything, tenacious reader, you know. So there's money out at stake as well. But it's not the end game if we have to find some other ways to do some things because for whatever reason, this didn't get handled in time to keep that quote, what people call free money, even though, as Mr. Allison said, it's not free money, it's your money. And we also have a responsibility to spend every dime of that in a way that's responsible to the entire public and the state. So that's what I'm looking for. I'm confident, I've said in multiple emails, we have highly valued employees. Both of those folks are highly valued. They are working together and they have some differences of philosophy and opinion and so forth. They know which their roles are and they're going to stay in their lanes. I think they're working it out. They're now talking to community service providers. They're talking about providing some space in our new facility, our $6 million facility, to community service providers in exchange for some coverage out county. Those are all great thinking out of the box things. Mr. Rushing talked about dial a ride, or I call it doc in a box. Okay, like the dentist, they put in a mobile and they send them out for teeth. Well, maybe we got to do something like that, whatever. But that's not for me, because I'm not that smart. It's for Dr. Nevin, it's for Liz King. I'm going to keep an open mind. I really appreciate everybody coming in and the passion and the information. But if we don't get along and people are just divided and all you do is argue and don't listen to other people to find consensus, facilitations, mediations, negotiations, that's what I did for 40 years as a lawyer. Mr. Fletcher will tell you that. They're difficult. They're highly charged. They're emotional. They're significant. That case is the most important case to that person. This is important to every citizen in the county. We take it seriously. We're listening. That's all I can tell you. But aren't able to say where do you stand on it, because decisions of this board have to be made at an open meeting. That's the law. So we can have consensus. We can have ideas on what we might want to do and discussion, but it doesn't come until we actually have something before us for a vote. There's no action item tonight. There wasn't when Mr. Fields was here. That was part of the problem. I think Bob tried to get an action item on a matter that was really a discussion item. It failed for lack of second. And he quits. I mean, it is what it is. I wish him well, but we're going to move on. You know, that's already, to me, that's yesterday's news. I wish him well. We're going to move on. We're here to serve you. We're going to do the best job we can. Everyone up here is hardworking, dedicated, and we're going to do the best job we can. So we thank you.
Commissioner Rushing.
And I apologize for earlier. You just looked at me and I thought I was good to go. Nothing else. I'll talk to you. I got some ideas in my head, but you got an awful lot on your plate. And if you even get just part of this resolved, the other things will fall in place. So get it fixed. You guys, I got confidence in both of you. So get it fixed. Don't look at the commissioners to solve your problems. It's your duties. That's your duty. That's why you guys got your contracts and what you're doing. And his contract, I'll make a mention, is 16 hours minimum. He's putting in a lot more than 16 hours, and you know he is. So he's addressing a lot of issues, going to a lot of meetings, and he's trying to work in the best interest of this county also. So please
Well,
work.
I remind Dr. Nevin all the time, he can put in any extra hours in that time tracking system and we would pay him. He does it out of, you know, what he says. He's not going to bill the county. And we all, you included, work beyond our hours allotted, for sure. And our whole team at the health department.
So Liz, before you step away, I guess what I am asking and sort of what I'm hearing from up here is if you could prepare something in writing, a solution or solutions with Dr. Nevin and maybe with administration, the three of you can meet and come together with next steps. What does that look like? We had some questions that were asked up here. Could we get those answered? I would like to see us keep trust in the community. We can't keep kicking this can down the street. I understand it is an important thing and we need to take it seriously, but health is important and these kiddos in these schools are important, and whether we're doing it or we're outsourcing it, it has to get done. So if I could task the three of you to meet and be solution-oriented and report back out at our next meeting, I think at least a progress report, so that we continue to hear from you, that would be appreciated.
Sure, absolutely.
Thank you. Moving on to old business, seeing none. Item 7A, the library board reappointment.
Make a motion to send it to full board.
Second.
Thank you. Any discussion? All in favor?
Aye.
Any opposed? Wait, all in favor? Sorry.
Aye.
Aye.
Any opposed? Motion carries. It's hot in here. There are no other human services matters before us tonight. Nothing for information only. I'll accept a motion to receive and file packets.
So moved.
Thank you.
Support.
Any discussion? All in favor?
Aye.
Motion carries. Motion to adjourn?
So moved.
Support.
All in favor?
Aye.
Any opposed? Motion carries.
Could we get a report from the administrator on our air conditioning? Maybe we should do that.
Do you want me to take
I
that?
thought we just fixed that. I don't know.
This room is on the same as the other side of the building, so it's still under,
Oh,
it's part of the construction still. Yes, it's hot. Just so you know, so I have proof, I took this from you, because it was for your meeting, which you wrote me
Oh,
this note.
we can do evening hours on
She asked
Saturday.
We got this meeting starting. Please keep it down.
Like to call the St. Clair County Board of Commissioners Judiciary and Public Safety Committee to order. Roll call, please.
Commissioner Angie,
Present.
Commissioner Beeden,
Present?
Commissioner Torello, Commissioner Samasco,
Present.
Commissioner Rushing,
Here.
Commissioner Vandebosch.
Here. Seeing no additions or deletions, can I get a motion to approve the agenda?
So moved?
Support.
Any questions? Hearing none, all in favor?
Aye.
Aye.
Opposed? Carried. Citizens to be heard. I have one. Gary Lockers.
Good evening, Board. Gary Lokers. I live in Kimball Township, 4074. Reason I'm here tonight, I want to talk about a few things. One, you know, we talk about health, and I want to talk about mental health. I want to talk about some of the situations that happen in our county judicial system with the judges and how they treat some parents and how it affects the mental health of parents. I mean, we've got some lawyers here, and we don't have to agree right here, but you know you've seen injustice. And I think it's important that we take mental health into consideration. I'm a father. I would never consider committing suicide, but I can also have empathy to knowing not seeing your kid because some stranger said you can't because of the terms that FOC sets. And I can totally see why men take their lives. And it pains my soul to know that happens. So I want to say that. Two, I want to talk about, in the Kimball Township meeting, we had 2 residents talk about traffic and how it's just really bad in certain areas. We talked to Rob Usikowski, and he's like, there's nothing we can really do. It's an issue we have to take up with the state. And I would beg to say, we can't put public safety in the hands of, we got to do a test, we got to do a survey, we've got to do a case study. What's the harm to make fines for speeding in residential areas? Very harsh. I don't think that's too much to ask for. Citizens, children deserve that. So that's an issue. I want to maybe, if we can go to legislature and say, hey, can we change things so people are safe, so people aren't traveling 60 miles an hour down a dead-end road? And then something else I want to think of. Over the winter, I worked for a tree company. We worked for Port Huron area, like the Housing Commission. And one thing I've seen in that program, there's no structure, there's no systems in place. Those kids are watching their parents just live. And then we need to institute systems to take care of those kids because their parents are not taking care of them. So then we have this chaotic system where these kids are not taken care of, so we need to take care of them. But then, where is the system in place to get people off that system? People call it the project. Oh, it's the projects. It is a project. The project is to get people off that system. But there's no system installed. There's no process installed. So I would ask that the board, you know, I talked to my dad yesterday. There's so many issues in the county. We need unity. We need to work together, and we need to just identify issues and work together so we can make things better for my son, for your grandkids. So when we pass on to the next world, they're not handed this bill of just debt in all areas. So that's what I got. I appreciate you, and have a good night.
All right. Any updates from commissioners on judiciary public service?
I just would like to make one comment. I lost it. So next week is the 24th anniversary of 9/11, and Port Huron, the city of Port Huron is having services. They've put it out on their social media. But I would just like to say thank you to all of our first responders for their service. I, just like many of you, remember exactly where I was when those planes hit the towers. But we are now coming up into a generation that does not remember. And so I think it's up to us to continue to share that message. So first of all, thank you to all of our first responders, fire, police, EMS, all of our healthcare workers. Thank you for what you do, and to the families of those that support our first responders, thank you for supporting them. We know that it's not easy, and so if there's anything you can do personally for the loved ones in your lives on 9/11 to recognize those folks, I would encourage you to do that. But thank you. I know you serve as a fire chief, so thank you for your service, and anyone else that's here tonight serving. So.
Any other updates? I believe Algonac's also got a ceremony. We usually go to attend that one. So there's one down south, and I believe there's one other one, and I can't remember right now. So, any other updates from commissioners? Conceptual initiatives, easy for me to say. Animal Control Advisory Board.
That was actually Bob Felix and Joy were doing most of that.
I chimed in, and of course, potentially, we're going to have a new county commissioner here, and that person, he or she, will be able to add some input into that. But I'd be willing to table this until next committee meeting. Because I have nothing, I have my concerns the way it was handled, but without the people that actually brought it forward first, I want to have them included in the discussion.
I think it's a pretty good idea. I mean, I know Joy had done some work on it and put together some stuff, and then she called me about it and some others. I talked to our administrator a little bit about it, so I think she's not here, she's on vacation, so I think table it. Is that a motion to table?
Yeah, I'll make a motion to table it for 1 month.
Yeah, because it's not really an action item, it's just a conceptual initiative. You don't have.
Well, she can just put it on for next month, and if she wants, she can ask it be added. Okay, we'll do that, that's fine. Is that okay?
All right, then, moving on to, there's no old business, moving on to new business then. Fiscal year 2026 MIDC grant approval.
Motion to send it full board.
Second.
Any questions on it? All in favor?
Aye.
Opposed? Carried. Homeland Security Advisory Council membership.
Make a motion to send that to full board.
Support.
Any questions on that one? All in favor?
Aye.
Opposed? Carried. Moving on to the palm scanner machine for, I believe that's county clerk, right?
Move to send to full board.
Support.
Any questions? All in favor?
Aye.
Opposed? Carried. Fiscal year 2026 donated funds agreement, probate court, Michigan Department of Health and Human Services.
Move to send to full board.
Support.
All in favor?
Aye.
Opposed? Carried. Blue Water Day Reporting Program Contract Addendum Recovery Court.
Motion to send to full board.
Second.
Any questions on this one? All in favor?
Aye.
Opposed? Carried. St. Clair County Community Mental Health Contract Addendum A, Recovery Court.
Make a motion to send that to full board.
Second.
Any questions? All in favor?
Aye.
Opposed? Carried. St. Clair County Animal Control Body Cameras.
Make a motion to send that to full board.
Second.
Any questions on that one?
Just some input. I believe it's $16,000 expense, or not expense, but it'll be cost $16,000. I think it'll be a very useful tool for animal controls. Just a comment.
Okay. Anyone else? All in favor?
Aye.
Opposed? Carried. Anyone else have any other judiciary or public safety matters? Can I get a motion for information only?
Make a motion to receive and file the Berrien County Resolution,
That's
Senate
what I
Bills
was doing.
293, 294.
There you go. Can I get a second?
Second.
All in favor?
Aye.
Opposed? Carried. Receive and file packets.
So moved.
Second.
All in favor?
Aye.
Adjournment.
Motion to adjourn.
Support.
All in favor?
Aye.
Is Joy's committee next?
Yes.
I'm going to do that one. Yeah.
Oh.
Carry my bionic parts.
There you go. We'll call to order the Environmental Public Works Committee, St. Clair County Board of Commissioners for September 4th, 2025. May we have a roll call opening, please?
Commissioner Angie?
Present.
Commissioner Beeden?
Present.
Commissioner Trello? Commissioner Rushing?
Here.
Commissioner Vandenbosch?
Here.
Commissioner Samasco?
Present. Additions or deletions? Seeing none.
Make a motion to accept the agenda as presented.
Support.
All in favor?
Aye.
Opposed? Motion carries. Citizens to be heard. I have no slips turned in on this one. Do you have anything? Nobody? Conceptual initiatives, nothing noted. Old business, nothing noted. New business. Item A, landfill engineering review, Civil and Engineering Consultants Incorporated.
I'll make a motion to send full board.
Second.
Motion is second. Any discussion?
Just a little bit. Could you give a brief description of that, Terry, please?
This is for the RFP for the peer review that the commissioners requested. The committee interviewed the multiple consultants, and this firm had the most experience with different bioreactor projects, so we felt they were the most qualified to do a peer review.
Now, was that the result? Was that, that's what your committee decided? Is that how that worked? Yeah.
Correct.
You're going to be doing one similar to RFP for the economic development?
Correct.
So that we have a motion, a second. Any further questions or comments? All in favor?
Aye.
Opposed? Motion carries. Item B, Resolution 25-21, approving the Wildlife Habitat Grant Program Project Agreement for Columbus County Park. Final action.
Make motion for final action.
Support.
Any discussion? Carrie, the final action piece of that, what is that about? Probably a deadline of some kind?
That's correct. It's the deadline.
All in favor?
Aye.
Opposed? Motion carried. Next, item C, contract approval, McKenzie contract for Columbus County Park Operations Center.
Motion to send to full board.
Support.
Motion and support, discussion. All in favor?
Aye.
Opposed? Motion carried. Item D, Aeronautics Advisory Board reappointment.
Make motion to send to full board.
Second.
Motion is second, discussion. All in favor?
Aye.
Opposed? Motion carried. Item E, Materials Management Planning Grant Budget Revision. Item E.
Make motion to send to full board.
Support.
Motion and support, discussion. All in favor?
Aye.
Opposed? Motion carries. We have item 8, Smiths Creek Landfill Activities Report, A and B. Does anyone want to move?
Make a motion to receive and file.
Second on that?
Support.
Motion and second. Anyone have any questions or any desire to have any comment on that from our landfill director? If not, we'll just move on. Hearing none. All in favor?
Aye.
Opposed? Motion carried. Item 9, Other Environmental Public Works Matters. I did add this Tom Hull had contacted me month and a half ago. There was an item called the USBR 20 realignment for St. Clair County. It's a bike path. And I was contacted by Tom because they wanted to do a county resolution of support for changing this bike path. That would have been like in July or so, thereabout. And I mentioned, I talked to Tom about it. I said, well, has anyone contacted the various municipalities, the townships, and the ones that's leaving and the ones that's going to? And he said he hadn't, but he thought it was a good idea. So then he did that. And I'm going to have him give us an update on that, because to me, this is an example of the transparency that people say we don't have, and maybe the community involvement we have, because we wanted to get the board wanted the community input before we decided on something like that. So, Tom, could you give us an update on that real quick so the commissioners know what that's all about? I think it's very timely that it shows we do care about local control and public interest in matters.
Thank you, Commissioners. I was contacted probably June, July by Carrie Irons through the Adventure Cycling Association, looking for support to change and realign the bike route that goes along Range Road through Kimball and Marysville. So what he cited is there's some safety concerns, obviously the speed of the traffic, the amount of traffic. So to realign it, so going through the township of St. Clair, coming up through Yankee, coming down Bush, and then down Michigan Ave right through Marysville, and taking that all the way up, so it kind of realigns back up there. This is coordination between MDOT, so MDOT is actually the entity that makes that decision. However, they want to see the municipal support from the county to advocate for this change to MDOT. And obviously that includes our local municipalities, road commission. I would like to note there is no significant changes that occur. There's no funding. There's no anything. It's the signage, which actually will be done by the Adventure Cycling Association to change that signage from Range Road over to the new route. So it actually, there's no other impact or coordination done by the county other than the support.
As far as community input, you're satisfied that you've endeavored sufficiently to identify the communities and reach out to them for that type of local support, and you're going to get back to us at some point on whether we're going to get a recommendation perhaps on whether we support it or not support it.
Absolutely. So I contacted Quentin Bishop from the city manager from Marysville. Marysville is going to pass a resolution per my conversation with Quentin. I also reached out to Robert Lewandowski from Port Huron Township, just to have that discussion. He said that if we would prefer a resolution passed, that they would begin to work on that too, as providing the template from the Adventure Cycling Association. So it's pretty straightforward in regards to, you know, the support from the local municipalities. I do agree, Commissioner Samasco, that it is important to kind of get their buy-in, as this will impact that route, the traffic, and obviously the cyclists.
So we might have something that coming our way to look at this when the snow flies, or?
I would love to have the resolutions that are signed by both the municipalities, hopefully for the October committee meeting, but I will provide an update at that point.
Any questions for Tom?
Yes.
Dave, go ahead.
Yes, like 50 years ago, I was in international bicyclists and races, but now that I'm old, of course I don't do that. But I looked at all the information you forwarded to us, and I see the bike path starts, one of them starts in Washington Township and goes all the way through, and goes up north. Yes. And the loop that they put there, was that loop already there, or is that going to just be an additional loop, or rather than one track? It was outlined in red in what you sent us.
So
right by Range Road and that area.
In the attachments that I sent, that is kind of the proposed change. So you'll see one route, which is actually USBR 20. That goes left up Range. The proposed route is going to come the other way. So that's the change that they're looking to make, you know, within the bike path.
Slightly different.
I've learned a lot about bike paths recently. Not within my wheelhouse, and no pun intended, but, you know, definitely interesting, and like to see.
That was terrible.
Support.
That was terrible.
Sorry.
I'm doing what I can, Commissioner.
You will be an expert on many obscure topics before you end your career here.
I'm learning very quickly.
Thank you, Tom.
Thanks.
Moving on to information only.
Make a motion to receive and file the monthly park financial documents.
Second.
Motion is second, discussion, all in favor?
Aye.
Motion, please, receive and file.
Motion to receive and file packets.
Support.
Motion, discussion, all in favor?
Aye.
Motion passes.
Motion to adjourn.
Second.
Discussion, all in favor?
Aye.
We are adjourned. Now, who's got the next one?
This time, I'd like to call the Community and Economic Development Committee to order. Could I have a roll call?
Commissioner Angie,
Present.
Commissioner Beeden,
Present.
Commissioner Trello, Commissioner Samasco,
Present.
Commissioner Vandenbosch,
Present.
Commissioner Rushing.
Here. Can I have a motion to accept the agenda?
Move to approve the agenda. Not much there.
Did I get a second?
Second.
I believe Lisa seconded that.
Any discussion? All in favor?
Aye.
Aye.
Aye. Any opposed? Motion passed. Citizens to be heard, I have none at this time. Updates, I have none. Conceptual initiatives, I have none. Old business, I have none. New business, I have none. Other community and economic development matters, I have none.
I got one. I'm trying to confuse here, but on the issue of the RFP on the economic development, what's the schedule or timeline on that? Is that something that's, when do you expect to start working on that, or?
We will start with the change in committee members. We'll start reviewing the RFPs this month and start scheduling interviews probably later in September.
Okay, thank you. Thank you, Dave.
I guess I got something. Just for discussion, where we're standing right now, would it be maybe added to the agenda for the committee meeting next month, that the Community and Economic Development Committee be attached to the Ways and Means, anything that goes there until we see a need to attach it? Because we've had like 6 months of nothing.
Actually, what I did is Saturday, after Bob resigned, you talked to me on the phone about it, and I said, well, I'll do it, because it's their board appointments, like for board chair appointments for different boards. Well, he had some boards, and you said you would take over his committee, so I said, I sent an email out to Kerry that on a temporary basis, you can take care of his committee and board assignments. And then I called, and Kerry and I talked about it. She said, well, she thought that required a board vote, and I said, well, I don't think so, because it's a board chair appointment. So I don't know, Gary, if I made the appointment, or do we have to have a vote on that, or?
You made it already?
I did it Saturday. I sent the email out. It's done. Okay, good. All right, so that's, so it's, you got it until further notice.
Until further notice?
If something
until
comes
you
up.
Withdraw the appointment?
I'm not going to withdraw anything, but what I still will reconsider, like Kerry says, after we get Bob's seat filled, we have 30 days. In fact, why don't we do that now? Do you want to tell us a little bit, Gary, about the process for filling Bob's seat so people understand that? There's been some confusion that I get to make the appointment.
Point of order, it's on the next meeting
Oh, is it?
agenda.
Oh,
Yeah.
I'm sorry.
Yeah,
Go ahead.
so let's just finish
I withdraw.
the empty agenda, and then we can,
Out of order.
yeah. Thank you, though.
It's hot. Come on, let's keep moving.
The information only then, I guess, where are we at here? What are we doing here? No,
That's actually my committee.
That's your committee. Okay, go for it. Dave.
Nothing on.
No information only. Can I have a motion to receive and file?
So moved.
Support.
All in favor?
Aye.
Aye.
Aye. Any opposed? Motion passed. Can I have a motion to adjourn?
So moved.
Second.
Support.
All in favor?
Aye.
Aye. We stand adjourned.
Guess I should have read the agenda. You know, closer.
You're just excited to talk about it. It's the elephant in the room.
If it weren't for the women in my life, I'd be a mess, I'm telling you.
No comment.
Calling to order the Ways and Means Committee. Can I have a roll call, please?
Commissioner Beeden,
Present.
Commissioner Trello, Commissioner Samasco,
Present.
Commissioner Rushing,
Here.
Commissioner Vandenbosch.
Here.
Commissioner Angie.
Present. Item number 2, additions, deletions, changes to the agenda. I see A here.
We
R,
need to potentially put that at 7F?
if you'd like.
Well, if we're going to add it to the agenda and we're going to take new business and accept the resignation, I'll make a motion to take the Felix resignation acceptance and list it as 7F under new business.
Support.
Thank you. Discussion? All in favor?
Aye.
Aye.
Opposed?
I'll make a motion to accept the amended agenda.
Support?
Second.
Discussion? All in favor?
Aye.
Opposed? Motion's carried. Number 3, citizens to be heard. I don't have any slips here if anyone wishes to be heard on Ways and Means. Hearing none, we'll move to number 4, updates. A, St. Clair in sale.
It's Gary Fletcher.
All right, as you probably read, the St. Clair Inn sold to a group out of Iowa, and it was subject to, I think it was about a $14 million PACE loan. What PACE loans stand for, they're essentially energy efficiency loans, and the government passed a law that allowed counties to approve those loans. And if the county approved it and a bank would lend on it, they had special status and they became a special assessment. And of course, it didn't get paid, it went into default, and the investors got nothing, the underlying mortgage lender got nothing, and the PACE lender took a haircut for, I think, about half of what they had loaned. And there's some confusion out there that the county somehow took a hit on this. And I had other people tell me that someone told them that, and then I had somebody say, oh my God, the county sure took a bath on the St. Clair Inn. I said, what are you talking about? And it could have happened that way, but because in the treasurer's office, they have a tax revolving, or a delinquent tax revolving fund. So people don't pay their taxes, and the township doesn't want to carry that receivable. The county takes the money out of that fund and reimburses the township or the city, and then the county goes about foreclosing and collecting the money. But when these people promoting the PACE deal came to the county board, the board said, I mean, our advice was, and the board was in full agreement, and the treasurer was in full agreement, that they could make their loan, but if it went into default, which a special assessment is a tax, that they're not dipping into the tax revolving fund. We're not going to reimburse them and eventually end up eating a bunch of the loan, at least the delinquent parts. And they resisted that, and every time we got a contract from one of these PACE lenders, they didn't put that in. We batted it back in. They took it out. We put it back in. They finally accepted it. So the way it really turned out is the loans went into foreclosure, and then the treasurer has to go through, they're carrying the delinquent loan, and their penalties and interest and foreclosure fees and that type of thing. And it was on the St. Clair Inn, property across the street from the St. Clair Inn in the Harrington. And what the treasurer got out of the deal, not lost, St. Clair Inn, the treasurer received $1,006,117.53, so a little over $1 million. Out of the property across the street, which is set to close, across the street from St. Clair Inn, the treasurer will get, which is the county, obviously, $81,080, so it's pushing $1.1 million. And then when the Harrington defaulted, it was all the same borrower, the county got more foreclosure fees, and I think that one was maybe about $120,000. So the county, instead of taking a bath in this whole process because of the way the board set up the process, will come out ahead, about $1.3 million in round numbers. So there was no bath, and with some of the other hits you've taken, it's nice to get some good news.
That's great news. Thank you for sharing that with us.
The company that's got St. Clair in, the Harrington still, they have no involvement with the Harrington.
Yeah, somebody else bought it, local gentleman that invests in real estate.
And this company, for the sake of St. Clair in, they might do something with it.
I did as much checking as I could, and let's put it this way, they bought it right, big time right. The investors and the lenders, I think, had about $40 million into it, and I think they paid around 12. So at 12, they should be able, if they can't do well at 12, then it meant somebody had to gift it to them, and obviously I think it's really nice. We went there once or twice. It was great. My granddaughter had a wedding reception there. They did a fantastic job, and I think that with the right management, promotion, flag, I think they'll do well. I hope.
Thank you.
Thanks, Gary. Moving on to number 5, conceptual initiatives. There are none. Number 6, old business, likewise none. Number 7, new business. A, drain manning table revisions, reclassification, deputy drain commissioner / project manager.
Make a motion to send to full board.
Second.
Discussion?
We have the drain commissioner here.
He's sitting in the third row.
Oh, there he is.
I seconded that.
Any discussion? All in favor?
Aye.
Aye. Opposed?
Opposed.
Carried. B, jury management system upgrade.
Motion to send to full board.
Support?
Discussion? All in favor?
Aye.
Opposed? Motion carries. C, land bank authority appointment.
Make a motion to send that to full board.
Second.
Discussion?
Yes. I believe it's the mayor of Marysville, and we need a city person on to make a note that it is city mayor for Marysville that will be on that board. We're going to get appointed.
Thank you. Anyone else? All in favor?
Aye.
Opposed? Motion carries. D, 2025 general fund budget adjustments.
Make motion to send to full board.
Support.
Discussion? All in favor?
Aye.
Opposed? Motion carries. E, Resolution 2522, Collective Bargaining Agreement, Public Defender Association, final action.
I'll make that motion for final action.
Support?
Discussion?
Just, that's another deadline issue.
We typically do union contracts for final actions, so they can be put into effect and implemented.
Thank you.
Do we need a roll call on that?
Any further discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries. Moving on to number 8, any
F,
other?
you got F, yes.
7F.
Sorry.
Sorry.
It's hot in here.
It's hot in here.
I'll make a motion to accept the resignation.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Moving on to number 8, other ways and means matters.
I do have a question. Since we have accepted Mr. Fields' resignation, and we have opened up applications, is there like a timeline for what's next? I know the deadline is the 12th, but what happens after the 12th? Chairman?
Actually, I was going to defer to Gary, or our administrator. I met with, shortly after Bob resigned, I called the first thing on Tuesday morning, got a hold of our administrator, and asked about some of the past history, and we talked about some options. So she sent a memo out that the applications will close noon on the 12th. We'll have a special meeting on that Friday to talk about the process, type of ballot, the number of people, do we narrow it down, all that kind of thing. That will leave then, put it on for final action on the full board meeting on the 18th, and would give us like the 16th and 17th if we wanted to do some interviews. I was in favor of just having people submit, and we'll look at their written material and then make a decision. Carrie thought it was much better to have like a live presentation with questions, people sequestered, and you come in and answer some pattern questions. I'm good with that as well. So, Carrie, I guess I'd leave that to Carrie's discretion, really, on that. Or we'll talk about it Friday, give some thought to, do we do a ballot, or do we narrow it down by some process, or, because it's not a plurality, it's got to be 4 of the 6 remaining members, it has to be a majority, I believe I'm correct on that. It can't be like 3 for one person, 2 for another, 1 for another, the 3 doesn't get it, it's got to be 4 votes.
Is there a time on the 12th that's been established?
30 days, or it goes to special election.
No, I'm sorry. For the special meeting you want on the 12th, was there a time?
Not really, but what did you think? Did you put it in your?
I need to know what time.
Well, no, I think it's in the memo. Did you?
Well, we
We did not
didn't
set a time.
set a time. I thought we would do that this evening, but I would propose 2 o'clock.
Lisa?
I will make myself available for that meeting. I just need to know when to be here.
I didn't either. I didn't know. Oh, that's fine. 2 o'clock's fine. Any
I'm good
discussion?
for anything, as long as I've got advance notice, sometimes I got to.
I'm gonna
I'm
double check
okay.
my
I'm
work
fine.
schedule, but I'll make myself available.
2 o'clock, Friday the 12th?
Yeah.
2 o'clock it is. Do we need corporation counsel there for any reason? I don't think so.
Yeah, that's okay.
Only a phone call away. So 2 o'clock.
The other point I wanted to just bring up is, I had set vacation before all of this went down, so I'm not in town the
You want
16th
to
or the
cancel?
17th.
You want to cancel for us? I'm just
No,
kidding.
no, I really need this break.
Are you going someplace hot?
Yes.
So maybe the 15th and 16th, and if they're,
No, I'm gone through the 17th. So I leave the 13th and I will be back late the 17th. So I'm back in time for our commissioner meeting because I scheduled it so I would be back here for
so
us.
your proposed solution is
Sometime the week of the 22nd
to have the vote?
to
Interviews.
and
Yeah,
then.
the vote. See, what
yeah.
I was worried about is if let's say we get on the 18th and we can't come to consensus, it would give us, we're not up against a hard deadline of the 30th. I don't have a problem with doing it on the 22nd at all, but how do people want to do that? We need to have Lisa here, obviously, so you're not available, so that's kind of what's the next best thing there, Carrie?
We'd, something the week of the 22nd, you would have until, you could do it that week. If something, you couldn't work it out the 22nd, you would have the rest of the week to do something as well.
Do you want to extend the deadline on the applications too? I mean, the more the merrier, I don't know, or do we keep it the 12th?
I think it's been promoted as the 12th. I'd like to keep it as the 12th.
That's fine. Okay.
I'm happy with the 12th, and I've been here a while, so I've been through this before, so
So it's
we'll be asking questions. I want to get them here. Let's ask some questions.
It'll be the 12th, and that'll be fine, and we'll do interviews for the following, whatever, put it on.
Sometime the week of the 22nd.
You guys want to do the interview part, that's something that you folks want to do,
Well, you got it until the 12th, then potentially we can have a discussion on the 18th, our regular full board meeting.
Decide
We could
that.
do it an hour prior too, possibly, if you're available, because we definitely want everybody here.
No, but the process, I really don't care how you guys want to do it. If we want to do where people come in and stand up and ask a series of questions, all the same questions, people are sequestered, that's how Carrie suggested, because you get their live responses and thought on their feet kind of a thing. Is that what you want to do, or do you want to have them submit their information in writing and then decide from there?
I'd be in favor of the interview.
Okay.
Yeah, we'll have their applications in writing on the 12th. We'll be able to see their packet essentially. I think, and we don't need to, I guess, decide this tonight, but, because we don't know, is there going to be 5 applicants to interview, or is there going to be 25? And
We're going to
that's
know
the
that
part
on,
that
we're
we'll
going to,
need
we're going to know that on, you're here on Friday.
Yeah.
The 12th, so we'll know by then what the number is, and then we can
Okay.
set a further schedule, I guess.
Okay.
Carrie, history, if I'm remembering correctly, when Greg McConnell and George Baldwin, we did the interviews, and we did a meeting prior to our full board meeting, so it didn't interfere with the business. My memory's correct.
It's been done several ways, depending on the applicants. Some have been done during the meeting, when there's only been 2 you've interviewed. You've done special meetings when there's been more. I've seen it done multiple ways in my time here. I agree with Commissioner Beeden. I think it's going to depend on the number of applicants and the number that the board chooses to interview.
We'll know that on the 12th. We'll make that decision on the 12th.
Okay.
We won't have it on for final board action on the 18th. We don't have Lisa here.
I'll be here for the meeting on the 18th, but I won't be here prior to that if we did interviews prior to that.
We could address it, some cleanup on the 18th. We're going to vote the following week, right? Do the interviews and vote
Yeah.
the following week. And pick a date, and we're going to do the third day of the last week or something. I mean, when do we want to have the vote?
You could vote the evening of the interview, the night of the interviews if you would like, if the board's ready to make a decision. If you want to deliberate, you could set another date. You only need 18 hours' notice to post a special meeting, so if you conduct interviews and you're not ready to make a decision, you could call another special meeting. Those
I'd like to see
options are up to you.
I'd like to see a set of meeting, give us at least a day after the interviews to, think about it, and then that's how I'd like to do it. And then, so if the last interview's on the 22nd, have the vote on the 24th or something, or whatever it works out. As long as it's a work day.
Carrie, did the memo include the process, what the statute says? The law on it?
No.
Okay. So just so everybody knows, what it says is the board must fill. so that means it's your job. But this section after that says, if you fail to fill it, it's a special election. And the reason that's there, it could say you shall fill it, and the problem is if you can't get to 4 votes, you can't fill it. And years ago, I was involved in one where it was a 3-3 deadlock for 18 ballots. It was just, boom. And there were reasons for it. And then they ended up going away from the 2 that was causing the deadlock and did a compromise, and it was never going to end. So it's possible that you just couldn't make a decision, and if you can't, then it goes to a special election. But it's your job to do it.
But we could, if we, on the, whatever date, that's why I picked the 18th, so that we'd have time, if we hit a deadlock, we could say, okay, let's come back next week and take another run at it. So I just don't want to get it pushed down to the last minute, vote on the 29th of October or whatever.
What was the date of his resignation?
29th.
So you gotta have it done within 30 days.
Right. So set it up, the consensus seems to be set it up for that second to the third week in October, right? No, third week in September. Third week in September. Third week in September, and then that might give us another week to do something if we have to. Or is that the 18th?
No, you will have to do something that week, the week of the 22nd, by the end of that week. Would you like that meeting at 6 PM that Monday?
I think people might like to come.
I can't make Monday.
You can't come Monday. What are you doing on Monday that's more
I'm
important
the
than this?
president of the golf league, we're in first place, and I want to be there.
Somebody's got to lose.
What Monday would that be?
The 22nd.
I won't be in town. Still out of town.
When do you come back?
22nd or 23rd from Missouri, so I don't know. It's the driving vacation, so. 22nd, 23rd, we're coming back.
Are you here the 19th?
Nope.
So that
We're either leaving the
leaves,
18th, depending on what was on our agenda, or after the meeting.
so that has us on the 24th, which is getting us very close to the deadline. Wednesday, the 24th. Everybody be here?
I'll be here.
After 8, I
AM?
worked that day, that 12-hour shift.
I think we should vote on the 24th. That would give us a couple days the following week if we had to.
So 8 o'clock,
What's that?
8 o'clock meeting?
In the morning?
So you can't-
No?
I don't care.
Well, I don't get off shift until 7 o'clock, so 10 o'clock.
AM or PM?
I don't get off at 7 p.m.
Let's have an 8 o'clock meeting. I don't care. Whatever you guys, I'm available anytime. You guys can.
If we need to do an 8 o'clock meeting, we need to do an 8 o'clock
Same.
meeting.
I'm on shift that day.
Depending on the number of applicants, you could potentially do it on the 18th prior to your board meeting. If you're,
Well, but, yeah, but then Lisa would miss the
Lisa,
interviews.
no, Lisa will be here on the 18th.
But
I'm
couldn't-
not missing the 18th.
Couldn't do the interviews.
No, Lisa will be here on the 18th.
So we could do them prior to your board meeting on the
That's-
18th.
Oh, on the same
Potentially,
day. I'm sorry, okay.
see what applicants we
That's
get.
fine, yeah, that's-
And then we
yeah.
can get the 18-hour notice out, have it on the 18th, have a meeting at 5 PM, and possibly the 18th.
Yeah, that sounds good. Do the interviews on the 18th before the meeting.
Just maybe tentatively, it makes me nervous pushing up against the 30 days notice because we can't go into the following week because we would be beyond our 30
Yeah,
days.
no, I like the 18th and do the interviews before when Lisa's here, even at 4 o'clock, 5, or whatever it takes. That sounds good. And then we can vote on the 18th, and if we want some more time, we can just move it if we have to, if we need more time, but something like that.
Can I ask Gary a question? The resignation, it said effective immediately on the 29th of August. The clerk accepts and of course, we accepted the resignation today. When is the official date? The 29th, or when the clerk actually got their hands on it? Because this issue happened when I was township supervisor, and I won election to this, and normally township, November 20th, they change offices. But I was reelected, or I was still holding the seat as supervisor, and I made my resignation effective the day I took oath of office as county commissioner. Because up until that point, otherwise they'd have to potentially appoint somebody. So that's the way we handled it there. They accepted my resignation. Once I took the oath of office as county commissioners, then their time frame started from that point to fill the vacancy.
I checked with the clerk on Saturday, and she said she received it in the email form, close of business on the 29th.
That settles it, but it wouldn't matter anyways, because he said, I resigned effective immediately on that date, so it's covered both ways.
So we'll make sure we get it covered.
You don't get extra time by saying it's, you don't start the clock tonight.
That was just for the purpose of making sure it was accepted by this board and reflected in the minutes.
So then your prior memo is still accurate then, we can, on the 18th and all that, and the closing on the 12th and whatnot.
Yes.
That sounds good.
So, just to reiterate, 9/12 at 2 o'clock?
Correct.
And then 9,
And then 9/18, potentially 5 o'clock, but I would suggest we wait till the 12th to set a firm time,
Sounds good.
depending on how many candidates the board would like to interview.
Most appropriate.
thank you. And then tentative vote the following week.
Well, on the 18th, right? I mean, that's the.
You could potentially vote at your full board meeting on the 18th, or you could schedule a special meeting the following week if you would like.
I mean, because if we're going to interview people at 5 o'clock and start the meeting at 6, I feel like we would need more than an hour to interview if there's going to be more than 2 or 3 people, right?
Deserving of a special meeting, if you want to do a special meeting the following week, if you can figure out people's golf and vacations and all that, that's all fine too, you know, and service time and whatnot. So when do you guys want to vote? Do you want to try and vote on the 18th, or you want to kick it over for some?
I think it's real easy. We wait until we get the applicants in by the 12th, 2 o'clock meeting. If there's 24, then we could potentially change the time to the 18th. If there's only 4 people, I think we can handle it very easily on the 18th at a 5 o'clock meeting. But wait till we get the applicants. And then we can make a decision for Terry to put out the time frame 18 hours prior to. Potentially we want to do it at 4 o'clock, but until we get that information with the applicants, I don't think we can make that decision.
I agree. Okay. Where are we?
Number 8.
Only you would know.
Sorry.
No, number
Okay.
9.
Was that discussion?
Okay. So, number 9, information only.
I'll make a motion to receive and file number 10.
Support?
Discussion? All in favor?
Aye.
Opposed? Motion carried. Number 11, closed session. A, discuss pending litigation.
I'll make a motion to go to,
I have the language, Dave, I'll help you out. I have the language, I'll help you out. I move that the board meet in closed session under Section 8E of the Open Meetings Act to consult with our attorney regarding settlement strategy in connection with the case of Linky Schultz et al. V. Matt King et al.
You sound like a lawyer.
You know, I've been practicing.
Support.
Roll call. You got to do roll call on that.
Can I get a roll call, please? Thank you.
Commissioner Beaton?
Yes.
Commissioner Samasco?
Yes.
Commissioner Rushing?
yes.
Commissioner Vandenbosch?
Yes.
Commissioner Angie?
Yes. Do we need to move to immediately adjourn following the closed session?
I'll make that motion.
Support.
Discussion? All in favor?
Aye.
Opposed? Motion carried.